As you recall, a screen-positive test result does not mean there is a problem with your patient's developing baby, but rather that there is an increased risk for a chromosome abnormality and/or an increased risk for an open fetal defect. Despite the increased risk, most screen-positive patients will still deliver a normal baby. This lesson discusses general recommendations for screen-positive test results, which may happen in the first or second trimester, and then further discusses the approach for your patient. If your patient is determined to be screen-positive for Down syndrome based on the first trimester screening test or Part 1 of the sequential screening test, she may be offered the options of genetic counseling and chorionic villus sampling or amniocentesis. A genetic counselor can help your patient understand the test results and her testing options. If your patient declines amniocentesis, she should have a second trimester serum test to complete prenatal screening for open neural tube defects. If your patient is found to be screen-positive for Down syndrome or trisomy 18 based on the sequential screening test, integrated screening test, or the second trimester quad test, she may be offered the options of genetic counseling, an ultrasound examination, and amniocentesis. If your patient is screen-positive for open fetal defects because of an elevated serum AFP, the prenatal screening lab may suggest that your patient submit a repeat sample for serum AFP analysis depending on her screen-positive result and gestational age. Women who are reported to be screen-positive based on elevated MSAFP should be referred for ultrasound examination and amniocentesis to rule out open neural tube defects and abdominal wall defects. A woman who has had a normal ultrasound and amniocentesis remains at increased risk for third trimester complications. Your patient was found to be screen-positive for Down syndrome with a patient-specific risk of 1 in 110. She elected to have ultrasound and amniocentesis. The results were all normal, ruling out Down syndrome, trisomy 18, and other chromosome abnormalities, as well as open fetal defects. To check your understanding of the material covered in Lesson 4, respond to the questions associated with this lesson. After listening to each question, pause the video and select your answer. Then listen to see if you are correct. A patient had her blood drawn in the first trimester for the sequential screening test Part 1 at 11 weeks gestation. She calls the office 2 weeks later inquiring about her test results. You check her records and there is no report from the lab to indicate she is screen positive after Part 1. You tell your patient, results from your sequential screening test will not be available until after Part 2 testing is done in the second trimester. Your Down syndrome risk must be normal, but you need to wait for results from Part 2 to learn about your risk for trisomy 18 and open fetal defects. The office did not get a call about a screen-positive test, so everything looks good so far. You must be at low risk since the lab didn't call reporting you were screen-positive. The correct answer is A. Your patient was found to be screen-positive for Down syndrome following her sequential screening Part 1 test. You should refer the patient for genetic counseling, if available, ultrasound, and possible CVS or amniocentesis. True or false? The correct answer is true. Your patient was found to be screen-positive for Down syndrome following her first trimester screening test. Chromosome results from her early amniocentesis were normal. You should recommend that the patient have her blood drawn for a serum AFP after 15 weeks gestation to screen for open fetal defects in the developing baby. True or false? The correct answer is true. Your patient is screen-positive for Down syndrome in the second trimester with a patient-specific risk of 1 in 110. Select the most accurate and patient-sensitive language to use when calling your patient. The result of your prenatal blood test for Down syndrome indicates that follow-up testing is needed. Let's schedule an appointment so you can talk to the doctor about your results. The prenatal blood test for Down syndrome that you had is positive. While the test is probably wrong, you need to schedule an appointment to talk to the doctor. Your prenatal blood work came back as screen positive for Down syndrome, which means you have an increased chance to have a baby with Down syndrome. While it is most likely that your baby will not have Down syndrome, follow-up testing is needed. Let's schedule an appointment so you can talk to the doctor about your results. The prenatal blood test for Down syndrome that you had is positive. You need to schedule an appointment to talk to the doctor. The correct answer is C. We hope this online course has enriched your understanding of prenatal screening.